Greetings to you all. So today's discussion would be on an OET medicine letter. Now, the reason for taking up this lesson is to give you a better understanding. Like when you have complex letters, which is similar to the referral letter which you receive in OET examination. So my aim over here with discussion of this letter is like when multiple dates, multiple questions comes on your question paper, how can you go ahead and formulate your letter? So I'll be discussing a live case note. I'll be displaying a question paper on the screen, which will be useful for you to learn. You will also be able to see the task which is given and how can we formulate the sentences. Before we go ahead, I would just like to share certain tips which will help you to write when you formulate an OET letter. Okay, now let me just tell you. Like, see, whenever you are reading a question paper in your OET examination, what you have to do is you have to make sure that you understand the task very well. You need to understand whether the situation given in the task is a normal situation or it is an emergency situation. Now, every time I've taken a letter, like most of the time I've taken normal situations where there is no life-threatening situation, patient is getting discharged, or you just need a referral from a doctor, or you need a continuity of care from a nurse, those kind of letters. But today I'm going to take an emergency situation wherein the patient may be suffering a life-threatening situation. So in those situations, how will you place your paragraphs? How will you place the information? Which paragraph you'll place the information? This is something what we are going to discuss today. Now, let's understand this. When we write a letter, the structure what we follow is the first paragraph which we write, we normally follow a structure of overview. So the overview should give the reader understanding of who's the patient, what is the problem, and what is the purpose of writing this letter. Then, please understand the first paragraph, it should be very clear that you write the purpose in short. The person should be able to understand the purpose clearly. Okay, now please understand that the purpose should be clearly visible or clearly able, the target reader who is reading your letter, he should be able to make out your purpose in the first paragraph. Then the second para will be always about the background of the patient. Now it depends, okay? Background of the patient, it completely depends because in some scenarios the second paragraph cannot be about the background. The second paragraph can be also about the recent event, but depends on situation to situation. The third para we write, the third para would be about the recent event which patient has gone through or whatever has happened in the patient's life, maybe he's in the hospital or at home. So what all events have taken place, those informations you'll place in the third paragraph. Then you have fourth para. Fourth para is where you do your purpose elaboration. So you need to make sure you elaborate your purpose very well. You say what you want from the target reader and what the person has to do in future. The patient whom you're sending, like you're sending the patient to another target reader, where if the patient has to do certain things like doing a follow-up or maybe a blood test to be done or maybe some medicines which has to be continued, those informations should be put up over here in the fourth paragraph, because according to the rubric of OET says that the first paragraph should have the immediate availability of the purpose and later it should be elaborated well. Fifth para will be about the closing. Okay, so you should be able to close your letter appropriately, conclude the letter appropriately, then you can have the closing part of the letter, that is yours sincerely or yours faithfully, depending on the situation. Okay, now there are some pointers which you need to keep in your mind if you're writing it to a person who is not known to the patient. So for example, like you're not writing it to a family doctor, the target reader is not at all aware about the patient, like about the patient's condition or patient's background. He's not aware about it. In those scenarios, you have to make sure if you have done, if any referrals you have done for the patient, any referrals you have done for the patient, or you have allotted for the patient. Like for example, you refer the patient to a physiotherapist, you refer the patient for an advice to an orthopedic surgeon, or maybe something which has happened where you had to make a referral. Previously, patient had a referral, patient had a visit with any other doctors or maybe a physiotherapy center, but it depends if it is relevant to the current situation of the patient. Okay, but keep in mind these informations are important if it is relevant to the current situation and to the relevance to the current target reader as well. Target reader is the person to whom we are writing. Second one, if any change in doses, Any change in dosages you have done for the patient. Okay. Now, for example, like a patient was having a regular medication, but later you have changed some doses, some dosages were changed. Those informations are always important in this letters. Okay. Now you understand the target reader very well, very clear. Understand the target reader, who is the target reader, what would be his requirement. Based on that, the information will be important. Third one, any medicine which has worked well in the past. Okay, any medicine which has worked well in the past, if you find, like for example, sometimes you may find some painkillers which has worked well in the past, those information will always come in, like in this letters. If the target reader is completely, like target reader doesn't know the patient, it's not to a family doctor, is not known to the target reader, then these informations are always important. Fourth one, like after this, any medicines you have given, or any referrals you have done, any medicine which has worked well in the past, these informations, if you find, it's always important. Now then we comes, after that, any changes with the pattern of his life. Okay, any changes with the pattern of his life which has been done in the patient's life recently, those informations are always important. Since how many years you know the patient, if it's an unknown target reader, since how many years you know the patient is always important. Please understand this. Okay, so any changes, any advices you have given to the patient, any suggestions you have recommended to the patients, any suggestions you have recommended to the patient, all those informations will always be important in any letters. Please understand, if you find these informations, make sure this is informed to the target reader so that he can plan his treatment accordingly. Now you need to understand, are you writing it to a medical personnel, are you writing it to a non-medical personnel, whether the target reader is going to plan any treatment for this patient or he's not going to plan a treatment. Like for example, you're writing it to a social worker, you're writing it to a pharmacist who will just take care of the patient's current situation, or the pharmacist will teach how to use a particular medicine. Only those scenarios are there, then these things are not of much importance. Okay, now if you have any doubt, which while I'm explaining you this, you can put it in the comment box. I can make sure that after this lesson I'll answer all your questions, and if you need any further suggestions, I'll also give you my direct contact number where you can discuss with me if you have any problems with the writing part. Okay, now I will move on to a live question paper so that we can have a discussion and we can see what to do in such kind of letters. Okay, so I'll just share this question paper on the screen. Just give me a minute. Now here we go. This is the question paper what we would be using it today. Okay. Now before I go ahead, I also want you all to know now how to read a question paper. This is also something every time I explain with most of my lessons. Okay, because everyone needs to understand how to write, how to read such kind of letters. Okay, let me share that first, and then I'll come back to the question paper again. Just give me a minute. I'll just get back to it once again. Before that, how to read a question paper. This is something I want everyone to understand, how to read a question paper. When a question paper is given to you, please understand, first, don't waste your time. You just have initial 5 minutes. So make sure the initial 1.5 minute you use it wisely. You understand what the case note is all about. Then let's get into it. Now, please understand, read the first 5 lines first. Okay, read the first 5 lines. Now from this first 5 lines, what you get to know is, you get to know what is the patient's name, who is the patient, patient's name, sorry, patient's name. You get to know his or her age. Sometimes you also get to know some background about the patient from the first 5 lines. In some letter scenarios, you may also even get to know a hint about the diagnosis or a hint about the problem, what patient is going through. Also, you may get to know, in some letters, you may get to know what is your position. Sometimes it's there on the top of the letter, or sometimes it's there at the end of the letter. Now, after reading the first 5 lines, don't sit and read the entire letter. Go to the last event which is given to you. Last event plus writing task. Okay, whatever the last event mentioned over there, read that and read the writing task. I'll show it on the live question paper how does this work and how useful it is. Okay, so you need to make sure that You read the last event and the writing test. From the last event, what you will get to know is you'll get to know what is the current situation, because in the last event you'll come to know what is the current situation patient is going through. You will get to know, wait a minute, okay, you will get to know what is your position, oh sorry, what is, who is your target reader, who is your target reader. You will get to know his position, his or her position, like what does he's a doctor, social worker, or maybe who is the profession, like what exactly is the person do, who is your target reader. If you get to know things, would be pretty easy for you. You'll be able to confirm the confirmed diagnosis or the confirmed problem what patient is suffering from right now. You'll be able to get that in the last event. So once you understand what is the current situation, once you understand who is your target reader, his position, and the 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 confirmed diagnosis of the patient, it will be pretty easy for you to write the entire case note. The reason is you will get to know like what is the current problem. You will get to know what is the purpose of writing this letter. From the last event, you will be very clear. The purpose of writing would be very clear from the last event. You and the writing task. When you read the writing task, you get to know who is the target reader. You get to know his position. You even get to know what is the purpose of writing this letter. And from the last event, you get to know what is the current problem patient is facing and what is the current situation for which you're writing and what kind of help you need from the target reader from this letter writing. This is something you will be very clear. Make sure you read the question paper in this way. I can assure you, you will be able to plan your letter appropriately. Now, on a live case note, I'll show you how to do this. Okay. Now, let's share the question paper on the screen so that you are very clear. I believe everyone can see this. Okay. Now, I'll just give 1 minute. I'll just wait. I want you to read this, those who are attending. I want you to read this first 5 lines. I'll just give 1 minute. Just go through it. Understand what the situation is. Then I'll have a live explanation on that so that you can be very clear with this. I'll give you 1 minute. Just go through it. Okay. Now, those who might have read this letter, it is very clear. The first line says, John Elvin is a 48-year-old patient in your general practice. You get to know this is the person's name, this is his age. You get to know initially when he came on 5/5/2011, he complained of occasional mild central chest pain on exertion, has mild asthma over previous or otherwise previously well, nil family history of cardiac disease, one pack day smoker and drinks 10 standard drinks 5/7. Now 5/7 means 5 days a week. It is pretty simple. Okay. Now from this reading, you get to know that you're going to write about a male patient who's 48-year-old who was there in your practice. Like the first visit which he was made to your clinic was on 5th of May 2011, where he complained mild central chest pain on exertion, and he also has mild asthma, which is like otherwise previously well. He's also a smoker and drinks 10 standards 5/7. That is 5 days a week. So you get to know about the patient, who is the patient and what is his age. Then let's move on to the last page. That is the last event. Now over here, the last event is 1/6/2011. Now what happened on 1/6/2000? Let's understand that so that you'll be able to understand what is the current situation. Is it an emergency situation or is it a normal situation? Now, 1/6/2011, you get to know that passing by medical center and complaints of sudden onset crushing chest pain on background. Now we get to know this very clear. Patient was passing by the medical center. All of a sudden, he has got a crushing chest pain on background of URTI and worsening asthma since last month or last day, which is not relieved by anginine. Anginine is a drug, so which means that okay, patient was already taking anginine, but which is not relieved by anginine. Patient had audible wheeze. You did some examination wherein you found ECG mild ST elevation in anterior leads, ST of 120, lungs on auscultation, moderate wheeze and mild bilateral crackles. You found this. And you also found SpO2 is 86% on room air, heart sounds, slight S3 sound positive. Now let's understand in assessment what was clear. In assessment, it was clear that patient is likely to have anterior MI. We are not so sure. See, this is something you have to be very careful when you're writing the diagnosis in the case note, like when you're writing the OET letter and you're confirming the diagnosis, you have to find whether it is a confirmed diagnosis of anterior MI or it is likely or suggestive symptoms. Over here, it is not a confirmed diagnosis, likely to have anterior MI. Okay. Then acute exacerbation of asthma, second degree to URTI, mild APO. Plan is paramedic transfer to emergency department. Patient is on O2 supply of 15 liters via non-breather mask. You can also see GTN patch applied, IV morphine 5 mg given, ipratropium bromide 500 mu mg given via nebulizer in view of tachycardia. Furosemide 40 mg given. Now, this was the last event which is given over here. From this last event, we got to know patient had an immediate chest pain, okay, on the background of URTI. Patient already had URTI and worsening asthma since last visit. Patient has audible wheeze. You also got to know on examination he has got an ST elevation in anterior leads. On auscultation, you found that patient has got bilateral crackles, heart sound S3 is positive. Right now, you've done the immediate management and you want the patient to be transferred to emergency department. And your writing task says, using information provided in the case note, write a refer letter to Dr. Jeremy Barnett, who is our target reader. The emergency registrar, his physician, on duty at Maribor Hospital, Lakes Road, Maribor. So what we need is we need the further assessment from this emergency department because patient has come to you with sudden onset of chest pain. That's the reason we need the further assessment and management. So by reading the first 5 lines, we got to know who is the patient and his age. By reading the last even, you got to know what is the current situation and who is your target reader. Now, after this, if you read the entire case note, you'll be able to understand how to formulate your paragraphs and which information you can put in this. Now, over here, we can see there are 4 dates. The first visit date is 5/5/2011. The second visit date is 12/5/2011, which is over here. This is the first date. The first visit which patient has made a visit to your place, to your clinic, was 5/5/2011. The second visit was on 12/5/2011. The third visit was on 26/5/2011, and fourth visit was on 1/6/2011. So you need to be very clear, like when there are so many dates, when they give you so many dates, how will you write, how will you formulate? Your letter should not be too lengthy. It shouldn't be like too much of information. You're stuffing it into your letter and your letter will be as lengthy, like more than 200, 230. Some people have even seen writing 250 and above. So that is not required. So now if you want to start the case note, we know what is the patient's name and what is the age. So the first paragraph will be, I'm writing to refer Mr. Elvin, a 48-year-old who is presenting. Now we said likely anterior MI. We are not so sure what is the confirmed diagnosis. This is the probable diagnosis, what we found from the last para. So you can write who's presenting with signs and symptoms suggestive of anterior myocardial infarction and acute exacerbation of asthma. And what we need the urgent assessment and management from the target reader. So you would write your urgent treatment and assessment would be greatly appreciated. So your first paragraph will be, I'm writing to refer Mr. Elvin, a 48-year-old man who is presenting with signs and symptoms suggestive of anterior myocardial infarction and acute exacerbation of asthma. Your urgent assessment and management would be highly appreciated or would be greatly appreciated. That becomes your first paragraph. Now, understand this in this letter. Let's understand this very clear. In this letter, this is an emergency situation because patient is suffering from like suggestive of acute myocardial infarction. Patient has got a chest pain. So your second paragraph will be the most recent event, that is 1/6/2011. Okay, so over here, what we need to write is like today he presented with what complaint. So today, Mr. Elvin presented complaining of sudden onset of crushing chest pain and audible wheeze. Now, not relieved by anginin and all those things, we can mention it later because right now, if you mention about anginin, there will be no relevance. The doctor, the reader or the doctor who's reading will not be able to understand when did this anginin was started, what was the role of anginin. So it's better not to write. The relevance should be maintained in all your OET letters. So I'll begin my second paragraph. Today, Mr. Elvin presented complaining of sudden onset of crushing chest pain and audible wheeze. Okay, then I'll directly go to the cardiovascular examination. Okay, now cardiovascular examination showed mild ST elevation of in anterior leads of ST 120. Okay, and slight S3 sound positive. And on auscultation, patient had moderate wheeze and bilateral crackles with maintaining an O2 saturation of 86% on room air. Okay, this is something what I can find. Now from the assessment, I'll not write anything because in the first paragraph already written likely anterior MI triggered by respiratory issues or acute exacerbation of asthma 2 degree to URTI. This I'll not take in this paragraph because otherwise it will be a repetition of information. Then I'll go directly to the kind of management I have given for the patient. So GTN patch applied is an important information in the second paragraph. O2 15 liters via non-breather mask is an important information. This particular information is the most important information that patient is on O2 supply, oxygen supply at present, which you can even put it in the fourth paragraph as of like when you're elaborating a purpose at the end, you can write off note, patient is on O2 15 liters via non-breather mask because that is the most important point. You can even put it in the fourth paragraph or you put it in the second paragraph, no problem. IV morphine 5 mg given, ipratropium bromide 500 μg given via nebulizer in view of tachycardia and furosemide 40 mg. So your paragraph, like if you want to write it in paragraph, you can write GTN patch, IV morphine, ipratropium bromide 500 mg via nebulizer and furosemide 40 mg were administered. So your entire paragraph will be today Mr. Elvin presenting of sudden onset of crushing chest pain and audible wheeze. Cardiovascular examination showed mild bilateral crackles and GTN patch for which GTN patch applied IV morphine 5 mg, ipratropium bromide and furosemide 40 mg were administered. That becomes your second paragraph. Okay, the reason for this to put in the second paragraph is because this is the most recent event which has happened in this particular scenario. So this we'll have to put first because this is an emergency situation. In the emergency department, when the target reader tries to read this, when he wants to know about the situation, the immediate problem should be available so that he can start with the treatment. Later, he can go into the background. Okay. Now, after this, let's move on to the entire page, the entire case note. We understand what can be the third paragraph. The third paragraph is all about the initial visit. That is when the patient was presented to you the first time, what was the situation? So let me take the stamp so that I can explain you. Now, on 5/5/2011, so you can write Mr. Elvin presented the general practice on 5/5/2011, complaining of associated mild chest pain on exertion. This is an important information. Okay, so this information is required. That is the first symptom that he presented when he first came to you. Has mild asthma, but otherwise previously well. Yes, important information. Nil family history of cardiac history. Now, this is a point like where do you need this information or can you ignore this? This is something you need to take a call because see, it can be a mild, I can say, it can be a neutral information, but since we are writing it to a cardiac, the target reader is a cardiologist. Since we are writing it to a person who will be taking care of this patient, and currently patient has got a cardiac trouble, we will write patient does not have, patient has not reported any family history of cardiac disease. This is the information which we can take because in this point, in this particular scenario, it becomes relevant. Patient smokes 1 pack of cigarettes and drinks 10 standard drinks 5/7. 5/7 means 5 days a week. This is an important information to mention. Patient is under significant stress with own business. Yes, this would be required because suddenly patient is complaining of chest pain and we don't know what is the situation, what could be the causative factor for this chest pain. It can also be stress. So initially when he came, he reported with significant stress with his own business. Yes, that is an information which we need over here. In terms of medication, patient is reported of taking Seretide 2 puffs BDs, salbutamol 2 puffs PRN. Yes, this is an important information. There are no reported allergies, hence you can ignore this information. This is not that important. Nil chest pain on examination. We don't need this information because things are negative. Things which are negative, we don't need this information. ECG, no abnormalities detected. We don't need this. Troponin level, no abnormalities detected. Hence, we don't need this. Assessment, we find early stages of IHT, stress-related chest pain, alcohol dependence, but not interested in changing. Okay. Now, understand this. If you read the entire letter, you will understand later patient had shown some mild ischemic changes. Okay, so and there is a confirmed diagnosis of ISD. So this early stages of ISD is not that required. Even if you don't mention this over here in the second paragraph, it is completely fine. So you can write Mr. Elvin present to the general practice on 5/5/2011, complaining of associated mild central chest pain on exertion. He has a history of mild asthma for which he takes seretide and salbutamol inhalers, which is over here. So you can join this over here. Okay, seretide and salbutamol inhalers. He smokes one pack daily and consumes about 10 drinks 5/7 or 5 days a week. In addition, he is under significant stress with his own business. Please note there is neither any family history reported. So this information you can take. Even this allergy part, if you want, since we are writing it to a doctor and you want to inform about like there is no allergies present, you can still put this in your second paragraph, no problem. Okay. Now, plan, check serum lipids, refer to exercise, stress test, review in 1 week. We don't need to write this because, anyways, we are going to reveal what was the serum lipid reports. We are going to review what was the exercise stress test report. We are going to review and write about it. So, hence, let's not write it in the second paragraph what we have written, the third paragraph what we have written, which is about the background of the patient. Let's not write this over here because anyways we are going to reveal the report of what happened on a subsequent visit. So we can take one more paragraph because over here we already got 5 information. We don't want to stuff more information and our paragraph will go too lengthy. That should never happen. Don't take more than 7 information in one paragraph. Now, next one is on a subsequent visits. Exercise stress test. You can see still only very occasional chest pain on exertion. Not that important information because anyways we have told the target reader patient initially complained of occasional chest pain. So we'll not say that. Has runny nose and pharyngitis at present with increased asthma symptoms. There is a rise in asthma, hence we can take this information. Attended stress test with mild chest pain and pain at high exercise load. Some very slight ischemic changes present in exercise test. Mild bilateral wheeze present. Cholesterol has raised mildly. So you can take this information. These 2 informations you can take, and there is mild ischemic changes in the report which we have received from the stress test. Now, if you turn the page and if you see the next point which is given on the assessment, we found that patient is suffering from ischemic heart disease. Now we have the confirmed diagnosis of ischemic heart disease. So hence we can write it over here, an upper respiratory tract infection. It's an important information what we have got confirmed on this visit. So hence we need to mention this information over here. So this would be an important information. Patient was commenced. Now due to this confirmed diagnosis, patient was commenced on Lipitor, nitrates, aspirin, and PRN adenine. Educated the use of adenine is required because I told you in the pointers, if you have started any drug for the patient, it's always important. If any drug which has worked well for the patient, it's always important. Any suggestions or education you have provided for the patient, which is also always important. Hence, these informations will be important. Now we can see in this paragraph also we got approximate 6 information about. One is about the medication, other is about the confirmed diagnosis, the other one is about the stress test revealing of mildly elevated ischemic problems and the other factors. So those informations we can take in the third paragraph, that is on a subsequent visit. So we can write on a subsequent visit, exercise stress test revealed very slight minute ischemic changes. Also mild bilateral wheeze was present due to viral upper respiratory tract infection. He was commenced on Lipitor, nitrates, aspirin, and adenine. He has been provided with some advice regarding improving his compliance, and we have also educated him about the adenine use. This is something you can mention. Now, we have already taken 3 paragraphs. First was about the overview. Second was about 1/6/2011. Let's understand this very clear, guys. Now, in this letter, you can see one thing. First is like we wrote overview. I'm writing to refer Mr. Elvin so-and-so with so-and-so condition. He would require the further assessment and management from your condition. Second paragraph, we wrote about the recent event. And third paragraph, we wrote about 5/5/2011. Since we already had 5 information over here, we cannot merge it with 12/5/2011. So what we did, we took this information as the most recent event, or I can say before today, the most recent was 12/5/2011. Hence, we took it as the 4th paragraph. Okay, that is on a subsequent visits. We found so-and-so issues and we have started with so-and-so medicines. Now, if you add one more paragraph and then the closing, your letter will be of 7 paragraphs. So you should never do that. You should be very careful. You should be able to summarize the informations accordingly. Now, rather than mentioning the date of 26/5/2011, if you read this entire event, you will understand how can you summarize it in 1 or 2 lines. It should not be more than 1 or 2 lines, so that we can merge it with this paragraph. Now, over here we can find subjective chest pain for the last week, which is a regular complaint what patient was having. Still complaint of frequent mild wheeze. We already informed that patient has wheeze, so we don't need this information to be repeated again. Often forgets to take serotype buffers because of ETOH consumption, that is alcohol, ethanol consumption. Objective mild bilateral wheeze still present, so which is not a new information. We have already informed patient is suffering from wheeze, and in the recent event also, that is the second paragraph, we said patient has audible wheeze. So there is no point in repeating this information. Assessment, we found mild asthma 2 degree, that decreased compliance with medication, alcohol dependence now affecting medication compliance. And the plan, what it did is emphasize importance on preventing anti-asthma medicines, recommended patient put a reminder, encourage patient to use PRN salbutamol until asthma improves, offered E2H dependence treatment, pharmacotherapy will consider this. Which means what we did over here is we have given him all the education and advices regarding improving his compliance with medication. So why not we just write it in one word? We write, like we will use a transition, we'll write, please note, he has been advised with some advices regarding improving his compliance with medications. You can write that very simple. Please note, he has been provided with some advices regarding improving his compliance with medication. So we don't need to write all this. This is the common mistake which most of the candidates do make when they write such letters. The common mistakes what they make is like they try to add one more paragraph and they repeat the information. See, this is a trick what they put in the OET letters, and people need to understand this very clear. Because if the informations are repeated, there is no point at all. The information should never be repeated. That is something you should understand. Now, most of the information what you would see over here are those information which you have already written in the case note, which you have already written in the second and third paragraph. So let's not repeat it. There is no point in repeating those informations. Okay. So what you can do is when you're writing the fourth paragraph along with 12/6/2011, you add this 12/5/2011, add this point as one line. Then it would be greatly appreciated if you could provide the further treatment and management. If you need any further clarification, please do not hesitate to contact me and you close your letter. Since we know the target reader's name, it would be yours sincerely and your designation. That's all to be done. There is nothing that complex in this. It is pretty simple. You just need to make sure when the case note is given, first 5 minutes, the initial 1.5 minute, read the first 5 lines, understand who is the patient and what is his age, read the last event, understand the prime diagnosis, the prime issue what patient is having right now. Based on that, understand what is the purpose, why I'm writing this letter to the target reader. If you understand the target reader's point of view very well, if you understand the target reader's situation and target reader's point of view, what kind of information would make a difference in the care provided to the patient, those informations are important. If you read it this way, you will never make a mistake of choosing irrelevant information. Things would be pretty easy for you. Okay, so I'll be putting the sample answer in the comment section. I'll be putting, or in the explanation part, I'll put the sample answer, which will make you very clear like how to write this letter. Now, I believe that I made it simple and things can be much more easier for you if you practice this. If you have any doubt, what you can do is you can just put it in the comment box and I'll be there to answer your question. Now, if anyone who wishes to contact me directly, you can also contact me on this number. I'll just provide my contact details over here, so that if you want, you can contact me directly on WhatsApp. You can contact me on this number and I'll be able to answer any of your question if you have. You can subscribe this channel. We'll be coming up with more lessons on live discussions of case notes for doctors. We'll be taking more complex case notes so that the explanations are clear. If such kind of letters come in your examination, you'll be able to handle it much more effectively. That is what our motto is. Okay, perfect. So please check in the comment section for the sample answer. I'll be uploading the sample answer as well with this lesson so that things are pretty easy for you. And if you have any doubts while writing this letter, you can contact me on this number and I'll be able to solve your queries. Okay, for more lessons, make sure you subscribe this channel. make sure it's there in your subscription list so that when we come live, you get a notification and you can make use of it. You learn from this because we're not charging anything for these uploaded lessons. We have our online lessons, we have our paid lessons which is integrated for like 1.5 month. We train candidates till their exams and we make sure that you clear your exams. So we've got a good success rate. So you can also take benefit of it, or else you just want to have a brush up on your modules. You can subscribe our channel and take benefit of these uploaded lessons. We are coming up with more lively interactive lessons on writing, reading, and other modules, which will be beneficial for you. Thank you so much for joining in today. Have a great day.